is Veronica Adams, and I will be talking about nursing in public. Nursing in public is nothing to be ashamed about. If it's done right, some would want me to clarify that. In my opinion, done right is modestly and discreetly. Nursing in public is a very controversial thing these days. Back in the old days, all women nursed their children, and if they didn't, they had a nursemaid that did so for them. There was no formula, no bottles to give the babies. It was not seen as sexual or wrong. It just was, and it was just the natural thing to do. This day and age, breasts kind of are seen as only for sexual pleasure, and that's not really the case. The truth about it is, a lot of women feel that either one, breastfeeding will ruin their breasts, and that's why they don't want to breastfeed. But really, ladies, the thing that's going to ruin your breasts is pregnancy. So it's too late, Two, they feel that it's a sexual thing. They don't want their babies to have anything to do with that. But really, it's not sexual. You're able to compartmentalize and, feed your baby and not get aroused by it, and, save the sexual stuff for your husband. It's nothing to be afraid of. Those two things are completely separate. Almost everyone I've spoken to has told me about being able to separate those two things, and it's just a natural thing. There are benefits for the nursing mother, and most people don't even think that the nursing mother has benefits. Breastfeeding burns about 500 calories a day, which helps allow the mother to slim back down to what she was before she got pregnant. It also helps decrease the risk of getting breast and ovarian cancer, which is very good if you have that running through your family. It actually decreases it up to almost 60% for breast cancer. They're also less likely to suffer from osteoporosis, and it actually saves families between $1,200 to $1,500 a year in formula if they were going to formula feed, which is astounding, really. The benefits for the breastfeeding baby is they're less likely to get infections and illnesses like diarrhea and ear infections and pneumonia. Breastfed babies are less likely to develop asthma and are less likely to become obese. It also reduces the risk of SIDS. The fear of nursing in public is a very scary thing for a lot of women. I know when I first had my first child, I was so scared. I was only able to nurse her for a short time, but the short time I did nurse her, I tried to stay inside the house all the time. With my second child, I did some research. I found out what my rights were, and I first started going out wearing a nursing cover to get comfortable with it, and I saw that it drew more attention to me and the baby and what I was doing. Eventually I became more discreet with my nursing, and I was able to do it without anyone even knowing. I've actually had people come up and pat my baby's head and rub her back and say what a cute little sleeper she is, when really she was nursing and they had no idea. A lot of people are afraid when they go out that they're staring at you and they're judging you, and what if someone comes up and asks you to leave? What if you get arrested? What if you're exposing too much? And the truth is, in most cases, they aren't, because they don't know what you're doing if you're doing it discreetly. The nursing covers, like I said, cover everything, the whole baby, your breasts. Like, you can't see a thing. But like I said, I've noticed it tends to draw more attention to what you're doing. You can just wear a tank top and a loose shirt and just pull one down and the other up, and everything's covered and nobody can see anything and everyone's happy. But it's always good to know what people's rights are. As a nursing mother, you should know what your state laws are and what your federal law is, in concerns like to nursing and all that. And for those of you that aren't nursing and don't ever plan on having anything to do with nursing, if you happen to see a nursing mother out in public and she's being harassed about it, I feel that you should do the good deed to help step up and step in and help support her and her rights, because she may not know them. And it's an embarrassing situation to be in. One of my slides in the PowerPoint actually has the link to see what your state laws are and what the federal law is concerning that. So if you or someone else gets in that situation, maybe you can help them, or they can help themselves by telling the people what their right is and that there's nothing wrong with what they are doing. Practice does make perfect. Yes, I can see people have a problem if a woman isn't going about it the right way and is showing too much. And in my opinion, there is such thing as showing too much, and it can be embarrassing if a woman has her whole breast just hanging out on display. But if you do so modestly and discreetly, no one will even know what you're doing. You won't get into trouble, and if you do, you can inform the person what your rights are, or what someone else's rights are. Nursing mothers shouldn't let other people, and we shouldn't let other people make nursing harder for mothers that are trying to nurse their children. They should be able to enjoy it and be comfortable with it and be able to nurse their children whenever and wherever their babies want them to nurse. I feel that the more we show people that it is okay to do this, the more we can get back to doing what our bodies were made to do, without feeling any shame in what we're doing. Nursing mothers are just giving their children the best and healthiest start at life. And I don't think they should feel any shame in that. And I think we should be able to help them do that. And it will just save us so much in the future. I've got a few videos and comics in the PowerPoint presentation that I attached, if you guys want to view that as well. And that's it. Thank you for listening to my PowerPoint. I just demonstrated during the whole thing that if this were a real baby, I would have successfully nursed without you seeing a single thing. So maybe in the future, if you see someone, you can congratulate them on doing a good job. And if you see someone in trouble, maybe you can help them know their rights and help the people harassing them know their rights. And maybe we can make this an easier thing for all those involved. Thank you and have a good day.